to Mia. And the two other siblings, MJ and Amara, were both brought into care and placed in a foster care home here in New Haven while Mia was in the hospital. Eventually Mia was discharged 3 months later and placed in the same home, which is good. So they're all in the same home there.
That's a good thing.
Yeah, yeah. Dad, initially we obviously looking at him as a reunification target, given that he was a primary custodian, but had some concerns about whether he could take care of all 3 children, especially given the heightened medical needs of the little one and the circumstances which brought her into care. Dad, noted that his work schedule was, variable and had a hard time kind of nailing it down, but as a result, oftentimes when we had a scheduled visit, he wasn't always able to make it. So we were able to assess his parenting. We reached out to Mom too, obviously, just doing due diligence, trying to figure out what part she was playing in the case and as a possible resource and who she might have in her family. Mom did admit to smoking marijuana. This case, there was some record, I don't even remember where it came from, but maybe there had been some marijuana usage with like PCP lace. But Mom was real hesitant to go to any kind of eval, so it made it really hard to evaluate her. We had referred her for a dual diagnosis mental health and substance use eval just to get a baseline and try to figure out how to go from there. And we made 4 separate referrals. All 4 times she was unable to make it. We always found out after the fact that she had something going on, or had forgotten, or had another appointment to go to, and I don't know, just kind of doubled down on Dad as the reunification target there. Again, we had visits once a week, and the times Dad came, he seemed like he was giving it a shot, but he had 3 little guys, and because the case aide who was doing the most of the visits usually described him as being overwhelmed in the visits. They had a lot going on there.
What were you thinking about that when you see that note about the case aide?
Well,
overwhelmed Dad.
Yeah, I had popped into the visits periodically just to kind of get a handle, and obviously saw Dad, do my other visits and kind of asked him about it. But he did seem overwhelmed to me. He seemed like he got a little guy. Miguel was 5 and wanted to get Dad's attention, and talked to him about started playing Little League and wanted to, meanwhile, he's got Mia, who is just very recently kind of started to become verbal and has made some progress, but really significantly impacted by the injury. She had the head trauma, and then you have the other twin sister who's also in the mix, and just a lot for probably anybody, I guess, but definitely hard to assess or see that Dad was going to be able to. Well, I'll be honest, hard to do it on his own, right? It's going to be, but obviously that's still what he was doing before the kids came into care, and there's still the hope that he could do that. I think as time went on, that became difficult. More recently, Mom and Dad got back together, and so they're asking for joint visitation. I think bringing it here, what we're going to try to figure out is at the 10-month mark, we filed the termination of parental rights because Dad, obviously the circumstances of the injury, I forgot to mention that Mia, actually around the time Joyce came on to start supervising the case, was re-hospitalized. She had some complications and had to go back and replace the stent and drain fluid. She had bumped her head, I think inadvertently, but had to go back in the hospital for a little while. So again, just with the severity of the injury and the risk there, with the lack of compliance that we had from the parents on the service referrals, we felt like at that snapshot in time it made most sense to kind of file the TPR in hopes that maybe we could still give Mom and Dad some time to work. But again, Mom did go eventually into a hospital in Middletown for an assessment. It's a 90-day inpatient substance abuse mental health dual diagnosis program. She stayed for 35 days, which is long enough to kind of get an assessment of her, but then left of her own accord and hasn't really been in treatment since. Not knowing where she's at. She's reporting that she's been clean, but hasn't been able to kind of document that or verify that or signing releases accordingly. And knowing that she still might have some active struggles that way, or we can't verify that that's not the case. Knowing that she's with Dad, who already had perhaps some supervisory issue. It's complicated. So we're trying to figure out how.
Trying to figure out what to do.
Where do these guys go? In the meantime, all 3 kids had been fantastically, cared for by their foster parents at the Clarks.
Uh-huh.
And so they've really thrived there.
Okay.
MJ had some developmental delays early on and was able to kind of get assessed. He was too old for birth at 3 when he came in, but he ended up going to Head Start, and he's made a lot of progress. He's been able to be enrolled in kindergarten. He's going to start in the fall. The girls have done great, so it seemed like maybe the best plan was a TPR based on the lack of progress parents were making, and adoption by the current caregivers who now have been caring for them for the last year and a half and at a really high level. Part of the complication recently is that the Clarks, who are in their 70s, said that while they love the kids, they can't envision raising them while they're in their mid to late 80s, and they're not
As teenagers.
As teenagers, yeah, and that's fair. But that was our hope initially. Was that they had done such a nice job and had built such a nice bond that the kids would have some stability there. And so we ended up having to put the kids on a pre-adoptive match to see where we could do. And unfortunately, right now, there's only one match that could take all 3 kids together, especially given me as medical considerations. Family of the Millers, they live out in, where do they live? They live
New Canaan.
Yeah. So New Canaan. So we're looking to see if we could possibly do that, but obviously New Canaan's a bit further from here. Yeah, I don't know what else. I'm trying to miss some stuff.
One thing I was wondering about with the mother,
Yeah.
the birth mother, when you said she was there long enough in the hospital to be evaluated.
Yeah.
What did they come up with? What did they say in terms of
Yeah.
what they thought was going on?
Sure. I think at the time that she had come in, I think there was a substance test that did show marijuana in her system. I don't recall there being any other substances there. They did. They did diagnose her as bipolar 1.
Okay.
I think she was prescribed lithium and Abilify, if I remember right.
Okay.
I think she had started taking those meds, and I forget what she said, what the side effects were, but she said she didn't like the way they was making her feel. So, as far as we could tell, and per her own report, I think she stopped taking the medications when she left the hospital.
And as far as you know, has she been involved in any? Has anybody been able to engage her in some kind of supportive psychotherapy, help her to understand what this bipolar? That's a pretty big.
That's a good question.
Diagnosis to get hit with.
You know what? That's a good question. We've never had that great of a relationship. I think that I got the case straight from intake, and she kind of viewed me as just the continuation of the people that took her children into care. So a lot of little fights, like things like where even at the hospital, I did a supervised visit, brought the kids up to see her, and I think we got caught in traffic and ended up showing up maybe 5-10 minutes late to the visit, and Mom was concerned that there wasn't enough formula in the packet, and I was trying to explain to her that the kids aren't even using formula anymore, but just snacks in general. It was kind of perseverating on what if you had been in traffic longer, what about, and it was really hard to kind of get through, and I don't know, we just never really kind of connected. So I've been doing I've been doing the best I can to kind of offer her services. I've been doing the best I can to make sure that she knows a clear pathway of what's expected of her from the department, what legally is expected of her in terms of specific steps, but yeah, I don't know.
I think that's what really makes, one piece of this case really difficult is the fact that moms are usually much more willing to be engaged and wanting to be the unification resource. And this mom, from what I know of the case and what Josh and I have talked about, is been pretty consistently hands off. Dad had the kids when they were taken, and I'd like to have them back, but I'm not willing to even have substance abuse tests so that I can prove that I'm using marijuana. And I think having had that 35 days, at least we had that, and we can see from that, that there's a mental health component to it. It's not just a substance abuse piece to it. I think there's a lot of unknowns about Mom, which really make it hard for us to move forward, feeling good about her being a part of whatever the plan's going to be. And I think now that Dad and Mom both kind of have expressed that they've reconciled, they're living together, and they feel that's a very positive thing, for them to be doing. The department